We are already dealing with the problem of COVID, and along with it comes something known as black fungus. Yes, now there are many more coming, like white fungus and yellow fungus. So it's a need of an hour to know what exactly it is and what are the things that we need to follow to keep ourselves safe. So to understand black fungus, or be it a white or yellow fungus, we need to first understand what is a fungus. Fungus होता क्या है? The simple and easy explanation of fungus is it is a living organism. Now it is not any particular animal or let's say a plant. वो animal या plant में कोई category नहीं कर सकते उसको. वो एक living organism है. Now the most common fungus that we find around us are mold, mushroom and yeast, which we make use of while making breads. Yes, ये सब भी एक fungus ही है. In fact, fungus is a very common thing, but it can be dangerous if we are not taking care of ourselves and of our surroundings. So this was a small information about what is fungus. Now coming to the main topic, that is about black, white and yellow fungus. So first I will be explaining what is the meaning of those, and then I'll be explaining you the cause, which is actually common for all three, and also the precautions. Black fungus is also known as mucormycosis. उसका दूसरा नाम है mucormycosis. This fungus mainly affect your lungs. Now how does it enter your body? It enters your body through breathing and skin injuries. Now this fungus is mainly, and I'll say naturally, found on the soil. In case if it enters your body and if your body is very weak, मतलब आपका immunity बहुत खराब है, आप strong नहीं हो, then it can be a very big issue for you. Once inside your body, it starts affecting your air pockets, behind the forehead, your nose, your cheekbones. The main symptoms of black fungus, मतलब कैसे हमें पता चलेगा कि किसी को black fungus ने इन्फेक्ट किया है? Nasal blockage, swelling of the face, numbness, आपको कुछ फील ही नहीं होगा, आपका फेस बहुत मतलब नम रहेगा, मतलब कोई हाथ भी लगाएगा तो आपको समझ में नहीं आएगा कोई हाथ लगा रहा है मुंह पे. Blurring of the visions, watery eyes, these all are the symptoms of black fungus. Now, as I said earlier, I will be discussing the cause and precautions about all this thing later on. So I'll just jump to the next part, which is of white fungus. So basically, what is white fungus? White fungus is also known as aspergillosis. Now, this fungus is more deadlier than the black fungus. See, in black fungus, your lungs is the one who gets affected first. But with regards to white fungus, along with your lungs, your skin also get infected, your kidney gets infected, your mouth and also your brain. So that is why it is little bit more deadlier than the black fungus. Now this fungus starts from your mouth and then it goes internal. पहले वो मुंह में स्टार्ट होता है और फिर वो slowly अंदर जाके एक एक पार्ट को अफेक्ट करता है. अब symptoms क्या है? So the symptoms will be cough, fever, diarrhea, then black spots on the lungs, which can be found only through various tests, white patches on the oral cavities, and the main is oxygen level will be reduced. So these are the few symptoms of white fungus. The latest type of a fungus which people are started getting infected with is called as a yellow fungus. Now the other word for yellow fungus is mucoseptic. Now this fungus is more deadlier than the black and the white fungus. ये बहुत ज़्यादा खतरनाक है ये दोनों फंगस है. इसका जो सिम्टम्स होता है वो इंटरनली होता है, वो अंदर ही अंदर उसका सिम्टम्स शुरू हो जाता है, बट जैसे कि वो नज़र नहीं आता बाहर, people are not aware of the fact that they have got yellow fungus inside them, and by the time it is out, it is visible, the symptoms starts showing up, they have reached a very dangerous stage. Now the symptoms of yellow fungus will be loss of appetite, आपको भूख ही नहीं लगेगा, आपको खाने का मन ही नहीं करेगा, वेट लॉस, अभी देखो खाना भूख नहीं लग रहा है, वेट लॉस हो रहा है, देयर आर n नंबर ऑफ रीजंस फॉर दोस. हम ये नहीं सोचेंगे कि वो येलो फंगस है, राइट, बिकॉज ये तो बहुत कॉमन symptoms है. So that's why it is little bit more dangerous. And very severe symptoms of yellow fungus will be slow healing of the wounds. मतलब आपको कहीं लगा है तो वो टाइम लग रहा है उसको हील होने के लिए, उसको ठीक होने के लिए, और फिर थोड़े टाइम के बाद उसमें से पस निकलना शुरू हो जाता है बहुत, और वो बहुत ज़्यादा हो जाता है. तो दिस ऑल आर द सिम्टम्स ऑफ द येलो फंगस. Now you all came to know about what is the meaning of white, black and yellow fungus. But now how will you know how a person is getting infected? एक इंसान को ये होता कैसा है, right? So yes, तीनों फंगस के जो कॉज है, the cause of all the three fungus are actually same. The first and the foremost cause of this is having a low immunity. If your immunity is low, then there is a chance of you getting infected with this fungus. The second cause which was observed in this was the people who have recently recovered from COVID. Those people were found to have got infected with this fungus. Now, what is the reason behind it? Medicines were used to improve their immunity, which led to hyperimmune response. Okay, now what happened was immunity was all of a sudden increased. Now this had an impact on the liver. There was a swelling and redness in the liver due to the hyperimmune response. So to have a control on that inflammation of the liver, steroids were used. COVID people were getting infected. Why? Because there were steroids present in their body. Now the third main common reason for them was having a very dirty environment. Surrounding में बहुत खराब है, यहाँ वहाँ कचरे पड़े हुए हैं, और yes, also because the air, the surroundings were humid. मतलब जहाँ पे मॉइस्चर ज़्यादा होता है वहाँ पे फंगस ज़्यादा ग्रो होता है. Now this also can be found in the patients with diabetes or any other illness like AIDS and all. So this fungus is also attacking them. Now what are the precautions that you can do, like कैसे बचे इस फंगस से? First and the foremost thing is eat healthy, be strong, improve your immunity. That is the first and the foremost precaution any person can take. Eat healthy, eat leafy vegetable, eat fruits, eat grains and all, so that your body will be strong, which will not only keep COVID or any fungus away, but yes, also other diseases. So that is the best way to keep any person away from any disease, that is to eat healthy. Exercise, keep exercising, don't go for a gym and all. I'm not asking you to go and join the gym, I'm just asking you to exercise. Even a 15 minutes walk, अगर 15 मिनट भी वॉक करोगे ना, इनफ है. बट येस, इट शुड बी एवरी डे. हर दिन आपको करना पड़ेगा, वरना वो एक्सरसाइज की तरह नहीं होगा. सो प्लीज़ ज़रा वॉक के लिए जाइए, दैट इज़ ऑल्सो इनफ. वो भी चल जाएगा, जिम में जाने की ज़रूरत नहीं है आपको. ओके. थर्ड विल बी कीप योर सराउंडिंग क्लीन. आपका सराउंडिंग क्लीन रखो. कहीं पे कचरा वचरा फेंक के मत रखो, कहीं पे कुछ कलेक्ट करके मत रखो. दैट विल कैन हेल्प इन द फंगस टू ग्रो. ओके. अगर आप क्लीन रखोगे तो वहाँ पे फंगस ही नहीं आएगा, right? So that way you can keep yourself and your family safe. And yes, if you are seeing any of the symptoms, I'll request you, please visit the doctor. Don't sit at home and try to treat yourself. अगर आपको कुछ भी सिम्टम्स दिख रहा है, प्लीज़ डॉक्टर के पास जाइए. बैठ के कोई इलाज करने मत बैठिए घर पे, आप खुद डॉक्टर मत बनने बैठे प्लीज़, बिकॉज दिस इज़ अ वेरी क्रूशियल टाइम. ये बहुत इंपॉर्टेंट टाइम है. अगर आप बैठ के घर पे बैठ के ट्रीट करने लगे और वो ट्रीट नहीं हुआ, तो चांसेस है कि वो बहुत डेंजरस स्टेज में पहुंच गया रहेगा, और बाद में आप डॉक्टर के पास भी जाओगे ना, तो आपको वो नहीं ठीक होगा. तो इसीलिए इफ़ यू आर हैविंग एनी ऑफ द सिम्टम, आई रिक्वेस्ट यू प्लीज़ विजिट अ डॉक्टर. सो आई होप you must have understood a little bit about all this fungus, and I hope I could be a help. थोड़ी तो मैंने आपको मदद की होगी. If yes, please do share with your friends. शेयर कीजिए आपके फ्रेंड्स के साथ, फैमिलीज के साथ, ताकि उनको भी पता चले कि ये है क्या. ओके. एंड प्लीज़ बी सेफ, प्लीज़ बी एट होम, प्लीज़ टेक केयर ऑफ योर सेल्फ एंड योर फैमिली. एंड येस, don't forget to like my channel, subscribe, take care, be safe, be at home, and yes, see you in the next video. Bye bye.